abdominoplasty. An abdominoplasty, commonly known as a tummy tuck, can be medically required in 3 distinct scenarios. The first is for patients who have experienced massive weight loss and are now dealing with a large amount of loose skin. If you've lost 5 BMI points, kept it off for 6 months, and are also having some skin irritation, the procedure may be considered medically necessary rather than cosmetic. The second scenario is if you have a hernia. In other words, bowel or fat is literally poking between the muscles, usually around the belly button. This may also be deemed medically necessary. The third scenario is to repair abdominal muscle separation, medically known as diastasis recti. During pregnancy, your abdominal muscles stretch so the baby has room to grow. And for many women, those muscles actually tear and separate and then don't go back to where they once were. For the vast majority of people, a little bit of helpful physiotherapy enables those muscles to come back together again. But for some, they don't. A welcome change in recent years has been the addition of the post-pregnancy abdominoplasty item number. If you are at least 12 months postpartum, have not responded to physiotherapy, and have a muscle separation of at least 3 centimetres proved by diagnostic imaging, your abdominoplasty can be deemed medically necessary and therefore covered by Medicare. But the most common reason for performing an abdominoplasty is cosmetic, which is completely fine and just as valid as any of the other medical reasons. So after you've done all that you can with physiotherapy, diet and exercise, but you still have abdominal separation and loose skin that bothers you, then Sydney Body Contouring can help. So what happens with an abdominoplasty? An abdominoplasty involves taking away the loose skin from your tummy, as well as repairing the abdominal muscles. Usually it will also include some liposuction around your flanks and your upper belly, which can be a stubborn area for most people. Some patients also choose to get a breast procedure at the same time, such as a breast lift, breast augmentation, or breast reduction. The surgery is carried out under general anaesthetic. We use our highly experienced anaesthetists in an accredited private hospital setting, so that you're in the best hands. Your safety is always our #1 concern. The operation takes 2 to 3 hours, depending upon the procedure planned, after which you'll stay in hospital for between 2 and 6 days, depending on what needs to be done. All your post-op care is in our clinic, where you'll be in regular contact with our medical staff throughout your recovery. The goal is to help you end up with repaired and tightened abdominal muscles, a flattened belly, and will have gotten rid of the loose skin. And will ensure you have a nice, low scar hidden in your underwear or in your swimwear. That's the overview. If you have any questions related to abdominoplasty or any body contouring in general, don't hesitate to reach out. If you would like to arrange a consultation, either email us or speak to one of our friendly staff. Get in touch today and find out what we can do for you.